Welcome to the Extremity Exsanguination Device, or EED, instructional video. The EED is a non-pneumatic tourniquet and is indicated for displacing the patient's own blood from the limbs to the central circulation and blocking the arterial flow into the limb in situations of low blood pressure, a bleeding extremity, or shock. The EED is a simple device made of a silicone ring rolled into an elastic stocking with rubber handles to facilitate application of the product. When rolled over the extremity, it compresses the veins, arteries, and other tissues and pushes blood and fluid towards and into the core of the body. As the product is rolled up the extremity, the tension on the ring increases to about 160 millimeters mercury. This will occlude most arterial blood flow. It also moves the blood out of the venous system into the core. This removes the demand on the blood supply from the legs and increases systemic vascular resistance. Used in conjunction with traditional methods of resuscitation, it serves as a bridge to definitive treatment for any shock state. Prompt transport to a hospital or to definitive care is paramount for complete stabilization and removal of the device. Indications for use are any case of pathologically low blood pressure or impending shock where the systolic blood pressure is 80 millimeters mercury or less. These indications include severe hemorrhage, hypovolemia or fluid loss, anaphylaxis, neurogenic shock, overdose, or toxidrome. How to apply the EED. Remove the patient's shoes. Place the EED over toes with handles away from patient, one handle facing the top and the other handle facing the bottom of the foot. Use bottom-facing handle to get the EED over the heel. Pull handles towards the patient and roll the EED to mid or upper thigh. Secure EED in place by twisting straps around the leg. Assess patient. If needed, apply second EED to the other leg. The EED's use on a limb should not extend beyond 2 hours. If use of the EED is needed again, an interval of full limb perfusion of at least 20 minutes should be allowed before an EED can be applied again on the limb. How to remove the EED. Once in place, the EED should not be removed until the patient is in a controlled medical setting under appropriate medical supervision. Remove sequentially, first down one thigh, then down the knee, and then down the ankle, all on one leg. In between each step, the patient's blood pressure and clinical status should be assessed. Repeat for second leg in same steps if applicable. The complete removal from one leg allows for repeat use of the EED if more than 20 minutes of free perfusion have elapsed and renewed EED treatment is needed. In review, the EED is a non-pneumatic tourniquet and is indicated for displacing the patient's own blood from the limbs to the central circulation and blocking the arterial flow to the limb. The EED's use on a limb should not extend beyond 2 hours without limb perfusion. Removal of the EED should be carried out in a controlled medical setting. It should commence as soon as the patient's hemodynamic status has stabilized.